Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code AgelessHealth and get a 10% discount. Order today.
information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle live stream. Glad you're here. Actually, it's Ageless Health live stream, and we're going to start using that tag so we don't confuse you on an ongoing basis. We've got a great program for you today, and we're building, right? We're building all the way up over the next couple of weeks to the in-house program at the Roselle Center for Healing in Fairfax. So we're going to be doing an evening on thermographic imaging and as it relates to breast cancer and actually other cancers. And I'm going to be talking about some remedies and things you need to know about and hormonal balance. And we're going to kind of put them all together and show you why thermographic imaging needs to be part of your ongoing annual evaluation. Far more revealing, in my opinion, if you will, of than virtually most anything out there. Remember that mammographic examination of the breast tissue has a huge false positive, false negative rate, but more importantly, the procedure itself is potentially cancer initiating. Why? Because you're taking soft breast tissue, you're crushing it with 45 pounds of weight, and then what do? You radiate it, and we know that radiation is potentially carcinogenic as a stimulus. So I just want you to understand that there are options out there, and please join us. I promise you that, Dareth Painter, who will be co-presenting with me, and she's our thermographer. She's the one that really gets this and understands the intimacy of what goes on. And, she works with a group of I think a dozen or so medical physicians. That's all they do is read these things all day long. And, she'll tell you it is not diagnostic. What she'll tell you is that it shows the predisposition from the blood supply that grows the tumor well before the tumor actually exists. So join us the 11th. All you have to do to register, you can go to drtomroselle.com and click. That's probably the way you came on now. Or call the office, 703-698-7117. I want to talk to you a little bit about some unknown pieces of cancer therapy. We're going to talk about it from a natural point of view, if you will. And, you can call it holistic treatments and natural treatments, that sort of thing. And, even naturopathic centers. There's a place called Envita, Envita. It's out in Scottsdale, Arizona. They do some very interesting and notable work when it comes to doing things in a integrative pattern. There are a bunch of physicians that work multiple platforms in providing holistic cancer treatment, and particularly in opting for the early, late stages of metastatic cancer. Very interesting people. And we've had the opportunity of kind of touching them on the shoulder and say, hey, and so it's a world-class integrative center, and they call themselves for the excellence of precision oncology for cancer patients. So just keep that in the back of your head, and that there's places like this. But I want to talk to you about some of the things that are being done, and so you understand what they are. In our office, we support the patient who may be going through cancer therapeutics. We support, their body's ability to resolve virtually anything, because our belief is your body has everything it ever needs to shift, to change, to cure anything that happens to them, whether it's pancreatic cancer, liver cancer, colon cancer, breast cancer is what we're talking about. There's things out there, and there's, you go back into the traditional realm, we're looking at different types of mushrooms. We're going to talk a little bit about those today. If you go to drtomroselle.com, there's actually a product that we put there that you can check with the company. They talk about how this works for a lot of different cancers. If you go to Ageless Health live stream and you scroll down a bit, you're going to see something called rapid immune recovery. It's a Shiakwa mushroom, and it makes apparently a huge difference. But we're going to talk about other things as well. And the oleander 4X is called Lor-X. That also has purported to have a significant impact on the viral types of cancers. Again, these things don't have the side effects that some of the other ones. And then if you want to detox the system, there's a whole system of eco filters there. That's nitrogen water, but we'll talk about that on another show, and we'll get into that pretty deeply. But when you look at cancer, with the patient's cancer diagnosis, regardless of where it is, there are several stages, and a lot of your integrative practitioners and others will tell you that there are 4 stages of cancer, but the precise stage depends on a host of many different things, and depends on which stage they're in. Breast cancers patients need to consider surgery as a treatment option, but maybe. So we go stage 1, stage 2, stage 3, stage 4 metastatic cancers. When you get to stage 4, the cancer's gone beyond the breast, and it's gone into the lymph nodes, it's gone to other organ systems, and so forth and so on. So we'll just leave it at that. If you've had a problem, you know where it is. But we want to talk about what can be done, and what's really out there, and how do you evaluate things, and we go from there. So we talked a little bit about, and have been talking about in the practice, something called turbo cancers. And some of the people out there say, well, this is an anti-vaccination conspiracy theory. And there's too much data out there now that shows that cancers are exponentially on the rise. And they're alleging, these people who put this out there, and I happen to say, there may be a lot of truth to this, that it came from these mRNA vaccines. If you listen to the program on WMAL a moment or two ago, you heard me talk about scientists from Harvard University that was talking about how things have been taking place over time. And what I'd like to do is read you that quote again, so you understand that there are things that are out there that you need to know more about over time. And this quote that I'm going to share with you comes from a man who extraordinarily well respected, and is made by a Harvard professor. And I'm going to read it to you, and then I'm just going to let you sit with it. But it finger points. So this guy says, and by the way, this guy's name is Dr. Herbert Ley, Ley. He was the former commissioner of all things the United States FDA. And he said, the FDA protects the big drug companies and is subsequently rewarded, and using the government's police powers, they attack those who threaten the big drug companies. People think that the FDA is protecting them. It isn't. What the FDA is doing and what the public thinks it's doing are different as night and day. Keep that in your mind as we go through the program today, when you think that the only way around your cancer is amputation, if you will, that you have to take these chemotherapeutic drugs, that you have to suppress immune patterns in the body. Guys, if you have prostate cancer, they're going to give you Lupron that's going to shut down your testicular testosterone. Why do they do that? Because they think that your estrogens that might be triggering the cancer, either your prostate cancer, or guys, you're getting breast cancer too, by the way, which years ago was unheard of, is coming from the estrogenic effect from the testosterone formation. You'd need the testosterone to heal. So my opinion is that 10 years from now, when they start reviewing the literature, they're going to say, I think we made a mistake. I think we have, but 20 years from now, some of these people who have problems could be dead, right? So let's kind of go through this thing. And there's an interesting article, and this was COVID-19 vaccines and so forth, and said 20-year-olds are now getting turbo cancers, and those who were once in remission have had their cancer come back 10 times worse. All of a sudden it flares up. It's there. Again, I'm reading from articles. And, we talked about in the office the other day with all our doctors that the mRNA vaccines have caused a 14,000% increase in these cancers and these showing up, oh my God, where they come from, turbo cancers. Well, let's get into it a little bit and let's talk about that. There was another article in the National Library of Medicine, NIH, and PubMed, one of my favorite places to go look and check out information. And it was talking about natural herbal compounds targeting breast cancer. And it goes on to say it's a review based on cancer stem cells. And when you talk about cancer stem cells, they're known as a major reason for therapy resistance. It's, again, a gift that keeps on giving. Natural herbal compounds are suggested to have a significant role in inhibiting the breast cancer stem cells so it can't continue to grow and perpetuate itself. That's where all this came from. And it was from clinical observation and things that they would do and say, oh, how did this happen? And then repetitively over the years, the same thing. But because most of these things don't produce a lot of cha-ching, across the board, why were they set aside, or why aren't they used better? So Science Direct, and it comes out of PubMed, as we talked about, in Scopus databases, and Scopus is SCOPUS, are explored and related in these articles all the way from 2010 to 2019. And as you get into them and you really look at what they're saying, they say, oh my God. And, how could this be? And I have enough respect for your intellectual platform to be able to make your own decisions. But you need to know where the stuff is, and you need to be able to understand it so you can make the right decisions. So you're going to talk, if you get into the articles, you're going to look about, you hear things like cancer stem cell niche, right? And basically what I just told you about, it's a self-perpetuating situation. And so when you have chemotherapeutics and any kind of radio intervention, they activate what we've heard about 1,000 times, 100,000 times. It's called interleukin-6 within the body, and activates these nuclear factors within the body, activating certain cells, which are related to the transmission of things that you don't want to have happen to you. So understand that the information is there. That's all the reason I'm telling you this. But let's get into some of the therapies that are available. If I said to you like cartilage bovine shark tissue, 4, or graviola 4, or hyperbaric chambers, or intratumoral immunotherapy, or monoclonal cells, or NAD4, or nutrition, or Chicago. Does any of that make any sense to you? Have you heard it anywhere before? Halotherapy, DMSO, insulin potentiation therapy. These are all natural therapies that are used without significant tissue damage. All the sickness that you get from going through traditional radiation and chemotherapeutics. Well, check out something called ITC Immunity Therapy Center. ITC Immunity Therapy Center. And these are people that customize treatment plan based on what really is going on with the cancer, with the initial diagnosis, any previous cancer treatments that have been tried, medical history of the person or the patient, other comorbidities that they have, your mental capacity, your physical health, and so forth. And they put therapies together, or identify therapies that may be the right place for you to go. There's things called RFA, radio frequency ablation. They can destroy things that way. There's cryotherapy. They can freeze the tumor. There's so much out there that is not being told, that they use in other parts of the world, but we don't use here. So it's important that we understand that there are things that are available to us, and that we need to understand. They confuse us by putting out things like HERTZ2 and EBC and all of that. And most of you say, what, huh? But because it came from the big kahuna, the White Tower doctor, you say, oh, okay. And then we would start repeating these things, to our friends and our families, and as if it's gospel, but we don't know what the heck they mean. We don't have any idea. So you got to familiarize yourself with the, if you call the HER2 receptors, and the early breast cancer, and what can be done about it, and what you should avoid, what makes it worse. Is your body capable with some changes to resolve things? Do you have a viral pattern inside of you that has to be dealt with first? And if that's the case, you got to deal with those things. There's ways that you can deal with it. We're messing, I don't know if you can see it over my left shoulder. We have a Rife frequency generator, and we're going to be doing research in the office on trying to put, a little different understanding. Again, we're not treating, we're just doing research, and we want to find out what the deal is. And, does it work? Does it work on pain patterns, inflammatory reactions? Does it help other cellular tissues, optimize themselves, and so forth. But I want to share a couple of things with you. There was a drug that, in my opinion, during COVID, that saved millions of lives. And if you go into Africa, where they used it on an ongoing basis, almost like once a week for protection, their rate of COVID infection was minuscule compared to what was happening throughout the world. What am I talking about? I'm talking ivermectin. Ivermectin is an antiparasitic drug. And, it was discovered first, I think, 1975. Its first uses were in veterinary medicine. And it was approved for human use in 1987. It was approved for human use. I want you to remember that. So everybody says, no, you can't do it, blah, 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 blah. There's a lot of manipulation that was going on. Ivermectin is a member of the avermectin family of drugs that were originally developed in the 1970s. And it was in Japan, and by a researcher who was a genius, and doing this stuff. And it came from a bacteria, Streptomyces. It was kind of interesting. But anyway, having said that, let's get to what I really want to share with you. Ivermectin seems to have a tremendous impact on suppressing tumor formation. And I'll go to, again, one of my favorite journals. This is something that came out in 2020. It says ivermectin suppresses tumor growth and metastasis through breaking down something called PAC1. And the study was in the esophageal squamous cells and the cancers that were there. And the article was really fascinating. And you go through it, it's lengthy, and there's a lot of backup information. But at the end of the day, they saw significant results in ivermectin. And then they started using it later on. Said, wow, what if it works here? Does it work with certain breast cancers? And lo and behold, guess what? It did. So ivermectin is something that you really need to know something about. So there's another one up on the screen, meaning on your understanding, and it's called fenbenzidol. And benzol, if you will, my tongue is getting in the way, is another antiparasitic. And it's also commonly known as Panacur. And several studies have provided a lot of information suggesting that Panacur have a potential in treating various different types of cancers, including pancreatic cancer, which is one of the most difficult. And somebody gets pancreatic cancer and say, oh my God, now what, right? And, research is ongoing now to show the effectiveness, but also the safety. And we're seeing that there's really no side effects, none that they're aware of. If you go to healthline.com/health/pancreatic cancer /fenbenzidol, it's spelled FENBENDAZOLE, you'll find the article. It's quite impressive. So knowing that there are things out there, so other people got to get involved in. So we go back to PubMed, and they have this as a study that was published, guess when? 2013. So what you should be asking is, if all this stuff has been known and they've been doing studies on it, Why haven't they allowed you the right of trial before you do something that is more invasive? Call me a little weird, call me a little crazy, but my brain goes, there's a reason, and I'll let you go to what I was talking about before. Who wrote the article? What do they get to gain by it? In this situation, who's suppressing it? Why are they suppressing it? And what do they gain from it? So use that as your guideline. There's a whole lot of things out there that you can do. We know that cancer of any kind hates an alkaline environment. That means the more alkaline your system is, the less the survivability of the cancer. So if you did nothing more than get rid of the sodas and the sugars and the tons of processed foods and meats, a lot of vegetables in your diet, you start doing that. Eating, if you're going to eat rice, you eat the alkalizing rices and so forth. Call our office, call the Roselle Center for Healing, and ask for a consultation with one of our nutritionists. They'll help you dietarily with that. They do a great job of it. I mean, they really do. And they will help you put your body back into that state. But without knowing that you have options, that's my job, to tell you what really is there. But don't do the ostrich thing, okay? Say, oh, it's not going to happen to me. And then all of a sudden it happens. I have a friend of mine who just ended up with a horrible metastatic cancer of prostate. And by the time he decided to do something about it, or had to do something about it, it was all over him. And he's doing some things that are outside the normal realm of cancer treatment. And when I spoke to him the other day, he seemed for the first time to have some strength that I haven't seen since he's been diagnosed about 9 months ago. But there's things there that you can do. So these turbo cancers are real deal situations. And you have to make sure that you are aware that you have some options, that you can do something differently, or at least cooperatively in conjunction with, and everything from energetic medicine, if you will, acupuncture, dietary patterns, a little bit of light level exercise. But, if you get into the things that we've talked about initially, and you talk about vitamin and mineral supplementation, there are certain things that your body needs to have. There's some really great articles out there, been out there for years, and there's people that have been using nothing but that for years. If you go to Very Well Health, there's actually a series of articles that are in there that will show you, what you can do, from everything from renal cancer and, other types of presentations. When you hear the term cachexia, okay, cancer cachexia, what does that mean? That means your cancer is eating you. So there has to be a way to support that. With our patients that come in the nutrition department, and one of the things that we do, we have to find amino acids which repair your muscles that have very little nitrogen waste, if you will, excretion into the urine. And there's several of those things that can be helpful. There's things with like ginseng and ginger and probiotics that will upregulate your energy system when you're not feeling well. You have to support adrenal function. You cannot shut down, testosterone. There's ways of using natural aromatase suppressors. There's huge studies on vitamin D in cancer. And at the end of the day, people who are vitamin D insufficient, are going to struggle with cancers. And, you read some of the medical, which is, 400 to 800 a day. I don't think so. I personally, Dr. Tom, takes anywhere from 10,000 a day up to sometimes 15,000. And then if I get lazy, I'll drop it back down a little bit. And my blood levels stay in the neighborhood of about 90 to 95. Sometimes it hits 100. But the functional medicine normals from multiple directions now say that 150 is where it should be. Join us on the 11th of September, please. And I promise you, I will dump. And Dareth is going to be, she's the model, she's the good cop, right? She's the one that's going to say, look, here's how you identified it. This is what thermographic imaging does. this is what you see. We're going to have pictures. We're going to show you before and afters. And I'm going to insert and kind of leave thought processes in your brain that would say, I didn't know that, right? But now you do know that. And once you do know that, you can make a difference in how you look at something. So join us on the 11th. I promise you it's going to be a night that you're going to go away with a ton of data, as you always do, because we got great practitioners. They really know how to put it all together. This will be no different. It might even be more than that. So please join us. Go to drtomroselle.com, register there, call the office 703-698-7117, reserve your seat, join us. Love to meet you if I haven't met you before. But we do these things because you deserve the information so you can make your choice. It's up to you. It's your decision. Don't let anybody force you. Don't let anybody make you think that they have it all together. Have them show you the data. Find out what the outcome is. Find out what the reoccurrence rate is. You know, we talked about stem cell a little bit, touching on the cancer. Do you understand that a lot of cancers reoccur like 10 years later? Why? Because the stem cell's still there, or the hormones haven't been balanced. If you have an estrogen problem and the estrogens are too high, which can set the stage for that, and you're balancing, you're not balancing progesterone and estrogens properly, then you're going to see that continue over time. There'll be a trigger. There'll be something else that's going to occur. I'm going to explain that to you. Dareth is going to show you how to identify it and why thermographic imaging is so important. Be there with us. It's going to be a great night. We're going to have a lot of fun. And again, I'd love to meet you. And remember, I do this program and continue to give you the data only for one reason. I love you all. Have a great Sunday. Take care.